our paper is about, we think, a very timely question, which is whether and how corporations can change to make progress on some of the more pressing societal concerns that go beyond firm level specific issues. And we are examining this question in the context of global health and the pharmaceutical industry. I should say this paper is together with Tobias Bünder, who is a PhD student at the Hertie School, and Johanna Meyer, who's also at the Hertie School. So we are examining our question of whether and how organizations can change, really, and trying to contribute to a debate that's been quite prominent recently in organization studies, which is whether and how organizations can address what have been called grand challenges, so complex problems with no easy solutions. But in our reading of this literature, there's certainly a lot more knowledge about why corporations are not able to do so, why they fail to make progress on grand challenges to which they often contribute themselves considerably. So we know about decoupling or largely philanthropic efforts that hinder progress. We know that instrumental thinking and lack of problem-centered approaches interfere with making progress. And there's often, even when organizations have a stated mission that is about stakeholder welfare, so certainly the pharmaceutical industry is such a case where they see their mission as creating medicine that saves lives, there's often a big, considerable gap between this mission and how it is implemented. And so that's where we try to enter this debate. And if we look at what is out there, we see that, so previous work has certainly highlighted that integration of central ideas about or solutions related to a social problem is really the key to progress. So how can organizations really make sure that some of these principles, for example, about addressing global health, are integrated into the commercial operations and do not remain outside, detached, decoupled from these operations. So that's certainly a key insight that we're trying to build on. And there's a sort of fragmented set of factors in the literature that might facilitate integration. So there's the role of leadership, responsible leadership. There might be internal stakeholders who act as issue sellers. There's the general question of corporate ability in terms of resources. But we see a certain lack of a more comprehensive perspective, especially over time, that might tell us more about how true integration can be facilitated. And so we study this question in the context of the pharmaceutical industry, and more specifically in the context of access to medicine. Now, access to medicine is a long-standing debate for the pharmaceutical industry, and it is based on the fact that many people in the world are unable to access medicine that is out there for various reasons. And so we're asking, in this context of global medicine, how does integration of key principles to facilitate access to medicine, how does it emerge and unfold over time? We specifically look at two companies that we think, and not only we think, but that are generally seen as leaders in this field. So you might be familiar with the Access to Medicine Index, which gives us a, you might say, objective view of how much companies make progress on this question. So we are looking at actually the long-standing leaders in this index, which is GlaxoSmithKline, GSK, UK-based company, and Novartis, Switzerland-based company, that have, as I said, long been considered leaders in this company. And we are really examining the process from the emergence of the topic for both companies up until today. So that's a 19-year period in which they have both been usually quite close to the top, if not the top of this ranking. And we have a range of archival data, but importantly, we've also conducted in the last 1.5 years, 37 semi-structured interviews with actors from both organizations at different levels. And we think this, this purpose of sampling here of these two cases might give us insights into how integration may be achieved. How to think about integration in this case. So we're proposing that we can really think about three different stages of integration with consequences for the organization itself. So what is actually changing? So, well, if we go back to the 2000s, we certainly see a state where there was no integration. So we largely had donation models, philanthropy, and we moved to shallow integration. We're going to talk about more how this played out in each case. But shallow integration is really about policy changes to the business model. So pricing issues, licensing issues. This is certainly has limited consequences for the organization. There might be some steering groups, and at the executive level, we see incentives to realize these changes. But what we're, of course, most interested in is this deep integration, where we are seeing not just policy changes, but the development of new business models and, importantly, deep-seated change to the organizational structure, to routines, to practices. So we, in also drawing on this Access to Medicine Index, we have a pretty good idea what changed over time in each of these organizations. So the main sort of takeaway message for this presentation I want to make is that we see two very distinct pathways of integration over this 19-year period. So with GSK, we see a relatively short period of what we call shallow integration, moving very quickly to a deeper integration. But then at the end of this period now, we actually see some reversal in this. In the other case, Novartis, a long period of more shallow integration with really just pockets of deep integration popping up over time, but now really a full-fledged integration, you might say, that's reflected in this very high ranking in the index, and we are actually awaiting the release of the new index this year and see how this plays out. Our analytical process is really about trying to understand what brought about these changes to the firm. So if we think at the firm at time t, right, this might be at any point in time, and then we observe different kinds of changes. So any kind of change we observe, we categorize it as either a business model or an organizational change. So a change to how the company might make money or what it sells versus the structures and routines and incentives in the organization. So that stood out from our data analysis. And then we're trying to understand, well, what brought this about? Now there's this sort of arrow that feeds back into the firm. Of course, there will come a point when there's quite a lot of integration at the firm, which then possibly affects further integration. So I'll give you a very brief and rather simple example is that at the beginning, certainly for GSK, when there was no integration, we observe a key mechanism that we think is reputational concern. So GSK was very much under fire for not providing access to medicine. And this initially led to some changes in the business model in the form of pricing adjustments. So making medicine cheaper for certain countries in the developing world. But this is, of course, just a simple example. The reality is more complicated. So we certainly see that. So in the case of GSK, we see from these initial beginnings of shallow integration, quite a fast move to a much more extensive and deep-seated integration. And we're really trying to understand how does integration itself then affect process in the companies. What are the mechanisms that lead to more integration based on what we have? So once we have made changes to the company, and here in yellow, we have highlighted all the organizational changes, so where there were actually new structures created, new processes, new incentives, new objectives for corporate members to realize access. So what does that do to the idea of integration? And again, to reiterate, these two cases were quite different in how this played out. This is still a work in progress, and we're still analyzing these mechanisms, but we think that there's certainly something going on in the sense that integration at some point might beget further integration, but what kind of integration? That's really our key question here. So our theoretical contribution, as it is sort of emerging from our data here, is that first of all, well, there is certainly an equifinality, or there are multiple integration pathways. So there's no one best way. We think each organization tinkered with integration in very different ways, but still with quite impactful results. So this early move to an extensive integration that really encompassed not just business model changes, but organization level changes at GSK versus this more experimental approach at Novartis, suggests that really there could be multiple ways, and that's what we think should inform theorizing over how to organize for grand challenges, given that these are two companies in the same industry facing pretty similar conditions. The other contribution we want to make, and this is where we're also hoping for some ideas here, is that we can perhaps see integration as a sequence of mechanisms over time. So how do mechanisms persist and get amplified over time? So once we adjust, once we change the organization, what does that do to the organization in the future? There's certainly external influences that we think could amplify certain mechanisms. So I've mentioned that GSK actually now is scaling back some of this, and this is resulting from, we think, an external event, a big compliance crisis that really led the organization to question whether it should be integrated in such a deep manner. But there could also be mediating factors that amplify mechanisms of integration, we think. So a CEO that's very sympathetic to the idea of integration then actually will make sure that there's even more integration. So these are sort of our initial thoughts. As I said, this is work in progress.